Welcome to Riding the Trauma Train, or welcome back if we've shared this space before. I'm Lydia, your host and fellow passenger in this journey of self-healing, inner strength and personal growth. This podcast is a safe, judgment-free space dedicated to the realities of living with and healing from trauma. Through personal stories and in-depth conversations with special guests, including therapists, healers, practitioners, and fellow survivors, we look at what healing can truly look like in everyday life. We explore realistic healing journeys and share simple, sustainable practices and actionable tools to support your well-being along the way. So grab your ticket, take a seat, and remember, you are not on this journey alone. Welcome to Riding the Trauma Train. I'm Lydia, your host and fellow passenger in this journey towards self-healing, inner strength and personal growth. This podcast is a safe, judgment-free space where we talk about trauma, healing and different modalities of how to get through that trauma, as well as self-empowerment. Today we are joined by Dr. Tracey Evans. Tracey is a neuroscientist and is somebody that helps people understand how trauma works in their brain and helps everybody through different types of survival mode and to work through that. So remember, you are not on this journey alone. Grab your ticket and take a seat. Dr. Tracey Evans, thank you very much for joining us on this episode of Riding the Trauma Train. You're very welcome. Let's dive right in. I am very excited to have you on here. Neuroscientist and coach and all these wonderful things that sometimes I wouldn't have married them up together. So explain how this came about.
Okay, so I call myself an educator and a neuroscience coach, but I do take techniques from different therapeutic interventions and I do use that in my work, which is very much science informed. So kind of what got me, not a typical straightforward path. I'm going to be completely honest with you, how I ended up doing this. Yeah, I still surprise myself. So I actually come from a background of trauma myself. And so I actually went into academia as a mature student. I'd come out of an abusive relationship with 2 children and I was lost, completely lost. And I thought, what am I, I felt a huge amount of shame as well. And I'd been speaking to a cousin of mine that had just finished doing a degree at Plymouth University. And I thought, oh, you know what, I might give that a go. And I didn't have any A levels. I had qualifications because my background was fitness, personal training. And so I approached the university and enrolled on the foundation year of a degree, and it was actually in biomedical sciences. That was going to be the degree I was going to be able to get onto, providing I passed my first year. Well, I absolutely loved it. This first year foundation, it was hard, but my goodness me, I suddenly felt I was doing something that felt like I was achieving for the first time in my life. Now,
Amazing.
that did start me on a cycle of external validation. So inherently, it was not being done for the right reasons, but I thrived. I got a first class honours degree in biomedical sciences. I then thought, right, okay, I'm quite interested in neuroscience. So I signed up to a master's in molecular neuroscience at Bristol University. I did it because it sounded good.
So good.
Yeah, it sounded good. We're looking at external validation again. And interestingly, right in the middle of the masters, I did have another severe mental health breakdown. So I did take a year out from that. Went through the process of engaging, not so well with therapy. Just going through the motions, really. Finished my masters and then decided I was going to go for a PhD. Came back down to Plymouth and started my PhD at the Peninsula Medical School down here at near Derriford Hospital, where I embarked on a journey of neurodegeneration. Now, what I didn't realise, and I loved this, I've got to say, I was thriving, but what I also realised was I was also running away. This external validation, I was running away. I was achieving. I felt good. Through this process, I have to be honest, I wasn't meeting the needs of my children emotionally. I was in survival mode.
Hmm.
I went on and did some postdoc work, and I then had my last major crises in 2019. And I had to come out of academia. My husband decided to leave the Navy, and I really did embark on several years of healing, which I am going to be honest was completely traumatic for everybody concerned. But I finally decided I was going to engage in this therapy, and that was because I met somebody in. It was actually a psychotherapist. I was told I had to do DBT for emotional regulation, distress tolerance, before entering into my trauma therapy. And she picked up in the group sessions that I wasn't really engaging, that I seemed to think that I wasn't fixable. So she did some one-to-one sessions with me, and we identified that I had taken my traumas, my complex traumas, and decided I was broken. I wasn't fixable. There was absolutely no point in engaging, and everything was shame driven. And she really changed my outlook on engaging in therapy. Bearing in mind, I was in my 40s. I started, um, I started in my teens showing emotional dysregulation and eating disorder. So this has been decades. Um,
Yeah.
and yeah, I suddenly realized, yeah, I was fixable. It was going to be a hard journey, and it absolutely was, but it has revolutionized me, my family, my relationship with my girls. And now I take this, and with the neuroscience, I didn't know why I fell into this field. And now I'm a firm believer that it was for a very good reason, and a life purpose. And that might sound corny, but I
No,
firmly believe that.
I love
And here
corny
we are.
anyway. Yeah, that's such a it's just such a positive outcome to what you've been through. So even going to like studying, it's almost a form of punishment. That's how I see it, because I am very, very much the same. And I will take on, take on, take on, take on. And it's almost like, okay, I've achieved it, but now what? And it's almost, even though it's self-validation, it's kind of proof to yourself constantly. It's like I wasn't good for some reason. If I do this and I've got that certificate, I've got that award. And so I can totally relate with that. And I'm sure that so many listeners can as well. How does the brain switch in trauma? What is it with the brain that kind of or how does trauma affect our brain? That's a better way of putting it.
Okay. So we have inherently, we are wired for survival. We've got regions of the brain that are very, very, very old, and these activate our stress response system, which is what we would know as fight or flight. So from a neuroscience perspective, we've got something called the autonomic nervous system. So it's automated. Um, it regulates heart rate, blood pressure, breathing, bowels, bladder, gut, etc. And we oscillate between what's called the sympathetic nervous system, this is fight or flight, and the parasympathetic nervous system, which we also know as rest and digest, feed and breed. Now, what we would want to typically happen is that we'd move between these depending on what stressors are coming in. Now, stressors can be a noise, it can also be a lack of sleep, it can also be our own thought processes. I'm not good enough. This will activate the stress response, and lots of other sensory information that will come in the way that people interact with us. When we have experienced trauma, then the body is going to be in survival mode, meaning we are switched into this sympathetic fight or flight system. And what that means is that we're primed, ready to fight or flee, even our own thoughts.
Hmm.
So we will see an increase in blood pressure, an increase in heart rate, a change in our breathing rate, blood supply shunted away from the gut. When we're in survival mode, we're not interested in digesting food. We want to get that blood flow to the working muscles. We're releasing glucose from our glycogen stores in the liver, going into the bloodstream. We're wanting to use that fuel and the oxygen from the change in breathing rate to really help us engage our muscles, our major muscle groups. We're not interested in bladder function, which is why our bladder starts to relax. So people will describe the fact that they feel like they may read themselves or lose control of their bowels. Now, when the stressor or the threat has gone, the perceived threat has gone, we have feedback systems that will communicate that we're now safe again. And now we can activate the rest and digest, the parasympathetic nervous system, where we start digesting food again, heart rate returns to normal, blood pressure returns to normal. Our pupils no longer need to be dilated, bowels, bladder, etc. All of those normal functions, the immune system as well, that gets down regulated because we're not interested in anything like that. We're wired for survival. And the problem that we have is when somebody is consistently in survival mode because of trauma, we get stuck in this on position. And over time, this chronic stress state means that we may respond to minor stresses in a hyper vigilant way. We also have a freeze response, which means that we may not respond at all. But if we go with the hypervigilance, then we become panicked at small mistakes. We will sense a change in someone's facial expression, and this will trigger that stress response, or we'll overthink it. And what also happens, which is really important, and I think many people don't realize this, is that when the stress response system is in a heightened state of arousal for a long period of time, what we do is we reorganize some key brain systems, meaning that the prefrontal cortex, which is involved in planning, goal setting, emotional regulation, impulse control, that gets sent offline because it's not a priority. In a stress response, we don't want to be thinking about the future. We're right here and now. What we also do is we see changes in our reward circuitry, motivation and drive. Tasks feel really heavy. We don't get pleasure out of the things we normally would get pleasure at, the simple things, because all of our resources are going in favor of this stress response system. And I kind of look at this as a triad of kind of our neuro lead, which is our executive functioning. We've got our neuro drive, which is our motivation and reward, and we've got neuro safety. And all of our resources are going to neuro safety. And over a period of time, we see structural and functional changes in these regions, including changes to how our genes are read. It's complex, but it's meant to protect us.
Yeah. So the way I can relate to that on a very, very basic level is through fitness. So if I'm somebody that is on a really strict fitness regime and I want to do this thing, but actually I get triggered in some way, the need or the motivation that I have to stick to a program is one thing. But when I'm triggered and my prefrontal cortex is kind of almost switched off, I will go for the rubbish food. I will literally ignore this kind of devil on my shoulder saying, "Oh, well, you did want to do it, but this chocolate bar is much more important than the fact that you want to do this giant thing." So it's almost like a switch, isn't it? And what parts of the brain are those? So you've got your prefrontal cortex. The only two words I know that are in the brain are the amygdala and the hemoglobin. No, not hemoglobin. That's blood.
Hippocampus?
Hippocampus.
Yeah,
That's the one.
that's
So can you tell me how they work within the within that scenario I just said? It like if you are on some kind of, I think fitness is the only way I can think of it at the moment, but if you're on some, you have motivation for something,
Mhm.
but something switches because you were triggered by a trauma event.
So the hippocampus and the amygdala are part of what we call the limbic system. And the amygdala is the gatekeeper to the stress response system I talked about, this autonomic fight or flight, rest and digest. When the amygdala is activated, it triggers the fight or flight. And when we get this sense of safety come back in, we're going to have rest and digest. Now, when things like exercise, really, really important. And when the systems are working together, kind of that when they're integrated, the neuro drive, the reward circuitry, the motivation, along with that prefrontal cortex, will keep us on track with our goals. Now, when we're in a state of chronic stress, we are looking for short, sharp hits of dopamine. That's when our meaningful rewards, such as exercise, connectivity with people, becomes compromised. That's too much. We want a short, sharp fix or hit of dopamine. And what actually happens is our brain is really good at storing memories of things that produce pleasure. Doesn't know whether these things that produce pleasure are going to benefit us in the long term or the short term. But eating cake, eating chocolate, we know that that lights up the reward circuitry.
Mhm.
We know it makes us feel good. But what happens is the ability for these systems, because the stress response security limbic system's activated, the ability to weigh up long-term consequences and rewards, short-term gains, etc., that's compromised. So
Mhm.
we're going to be looking at eating sweets. We're going to look at scrolling on the phone. All of these small things that give us a small spike of dopamine because the brain is wired to seek out pleasure and avoid pain. And actually, that's a reward circuitry that also becomes involved in addictions. Many people that have experienced trauma, they do struggle with different types of addictions, and this circuitry is disrupted in that. So hopefully I've explained that in a way that kind
Yeah,
of is clear.
definitely. If you can understand how your brain is working, if you can understand how trauma changes the brain, how can that knowledge empower somebody that is going through that?
Okay, so I think the very, very first thing always comes back to self-compassion. This idea, moving away from the idea that we're not fixable and actually honoring the fact that whilst it may feel counterintuitive, our nervous system has done its damnedest to protect us and keep us safe. And so because we can get this fear that it's doing what it shouldn't be doing, and it's just got hyperactive, hypervigilant, or with numbness kind of shut down. So we can honor that. We come in from a place of compassion, and the first thing that we need to be doing is communicating safety. We have to communicate safety. It's the only way we can manage that stress response system. It's the only way we can override all of these changes that have happened within the nervous system and the brain. And when we come in with a place of compassion, love, understanding, communicate safety, then we can start to re-engage those other regions of the brain. Because when the limbic system starts to feel safe again, it will allow that prefrontal cortex and the reward circuitry to come back online. And when these three systems are communicating with each other, we can start planning for the future. We can start connecting with people that provide us with a sense of safety, love, unconditional love. We can start thinking about those long-term goals that we have. Where do I want to be? And this sense of achievement, we've talked about achievement in terms of maybe academic achievement. That achievement can be getting through one day. Something I notice a lot. One of the things I do with people I work with, or when I'm on social media, I'll say, what is something you've done today that you're proud of? And can you do like a happy dance or say, well done me? And people are like, I'm embarrassed.
Mm.
Now, remember that voice in your head the brain doesn't know whether it's true or not. If you think happy thoughts, you get happy chemistry. If you think trauma thoughts, you get trauma chemistry. And if we sit there for a moment, you go, you know what? That was hard, but well done me. Well done me. We are going to get serotonin, a mood regulator in the brain, that is. And we're going to get a surge of dopamine that says, yeah, that feels good. I want more of that. Now we build momentum towards creating change and changing the landscape of our future. And it's these small steps that start to make us feel more empowered. I've got this. I can do this. I'm not stuck in this box that I thought I was stuck in, just surviving. And it's the small wins, there's small win theory. These small steps, they build momentum. It doesn't have to be a big goal. And if something feels too big, break it down into little micro loops. and tick it off and go, well done me. And that is going to give you that surge of dopamine. This works with the prefrontal cortex, and the cortex says, hey, okay, what are we going to do next? What can we
Yeah.
do next? What can I do? And this is where we start to see change. Meanwhile, we've got a safe limbic system going, yeah, we've got this.
It's, do you know what came to my mind when you were saying that is Mel Robbins and her high five theory. Like if you say to yourself, "Well done," you could also like almost go into the mirror and give yourself a high five, but like give yourself eye contact, like you would if it was a friend or a colleague or a sports
Yeah,
person, teammate, that's what I'm trying to say. Yeah, so if you gave yourself a high five, like that in like even thinking about it, look, we're both smiling. It's like instantaneous. Yeah, we can get into a negative spiral, can't we? We can start that negative thought and then we keep going down and down and down and down. It is really important that we need to spiral it back up. Like the spiral goes both
yeah,
ways.
it does. You were saying about sports, and it made me think about, you know, for example, visualization. We know athletes use visualization to perform really well, working through scenarios. Is it the swimmer in the Tokyo um Olympic Games? They got water. He got water in his goggles, but he had practiced it so many times. He managed to succeed. Is it Michael? I can't remember his name. For some reason, it is completely left me. I need to remember. But visualization, thinking ahead and visualizing, and we can do anticipatory visualization, visualizing how things are going to look when you complete something hard.
Yeah,
That power of those thoughts is incredible. In the same way as you said, you can use it to come down in the spiral, but you can use it to come up. Visualize yourself
absolutely.
doing something that's stepping out of your comfort zone, not too far out of your comfort zone, because then we're kind of not so motivated to do it. But
Yeah.
yeah, visualization is what many leaders, but I believe athletes do. I've talked about it with my little 7-year-old grandson and his football. You know, it's
Yeah.
powerful.
It is definitely powerful. I think it was Dana Grant that said, I was watching one of her reels on Instagram, and she said, "You step into what you want to do, and the universe will catch up." It's the
Yeah.
same with your thought process, isn't it? You need to reinvent the wheel, as it were. If
Yes.
you've
Yeah.
been through trauma and we're in this kind of negative bubble, spiral, negative thought process, if you, like you say, if you give yourself the small wins,
Yeah.
those small wins will then eventually turn in it's like little piece of the pie will end up being the big pie.
Absolutely. And kind of reflecting on, at the end of the day, because it's very difficult to kind of I'm not one for always having a positive mindset, because I
Mhm,
do believe that, that life does come with highs and lows, and we need to be resilient enough to ride them. And so increase our window of tolerance really around stressful events, because they're inevitably going to come in.
mhm,
But I think it's really powerful at the end of the day to actually reflect on how the day went. And, this idea of practicing gratitude comes back to, actually, if you have a practice of gratitude, what went well today? What am I grateful for? It makes the prefrontal cortex scan the day, pick this information out. The more you do that during the course of the day, your brain will go, I need to remember that for my gratitude practice later. That's something to remember. And what happens is we start to notice,
mhm.
have to go back, trawling back through the day. We recognize them in the moment. And
Yeah.
this is kind of really reinforcing and empowering.
Yeah, I went for a walk with the dog this morning after dropping the girls to school, and it was so windy and so cold, and I was in my husband's, dry robe thing, and I was stood there, the wind was blowing it so far, and I was just stood with my arms out thinking, I am so thankful I am wearing this coat. I may look like a child in their dad's jacket. However, I was so grateful. And it was in moments like that where you just think, and that is a little win. It makes no difference to you or anyone else in the world, but in that moment, it
Yeah,
was so amazing.
I love
Um,
it.
okay, so can you tell me one myth? about trauma and the brain that you think a lot of people believe and how you can help them reframe that?
One myth about trauma and the brain. I guess it always comes back to this idea of not being fixable.
Yeah,
I think because this is a big one, so many people, let's say, for example, well, the one thing we tend to personalize and, well, what could I have done differently, especially children when they're growing up and the prefrontal cortex is developing, they're reflecting on it with from an adult frame of mind. It's very easy to kind of look back and go, what could I have done differently? And of course, we can't. We can't. Um, but I think we tend to think that there is something wrong with me. And I think this feeds back into what I was saying earlier. And, there is a lot of stigma. We have to be very honest. There's still a lot of
yeah.
stigma when people are talking about their traumas, including professionals. There are mixed opinions about, I get mixed receptions from people with me talking about my trauma. You shouldn't be talking about it. Why is that? Because as a neuroscientist or someone who understands the brain, I'm immune from trauma. Is that,
No,
or it
it's the
doesn't make
same as
sense?
yeah, it's the same as a counselor or a therapist. Like, everybody gets a bad day and everybody has been through something. Doesn't matter to what extent or how extreme, the trauma to yourself is the trauma. So you have been through something. But yeah, no, I think society seems to think that if you are on that path, then you're already healed. You're already
Yeah,
over everything.
absolutely. And I think that's the thing. I often say I'm in recovery from complex PTSD. And the reason I say that is because I don't think I will ever be fully healed. I've processed, but I don't think I'll ever be fully healed. And with that knowledge, if I get triggered, I'm not going to say to myself, I've gone backwards.
Yeah.
I haven't healed. I haven't processed. I'm just going to recognize that there's some residual trauma that's always going to be there. And that's okay. That is okay. I can still engage in life. I'm not ashamed of the fact I may have been triggered. But what I can do with that information is use the skills that I've learned to keep that in check. Because if you think about, you can process trauma, but that doesn't erase it.
No.
Doesn't erase it. It's still there. It's still in that the hippocampus that you were talking about, the memory region of the brain. It's got a cabinet of all these things that have happened. And the reason it keeps this filing cabinet of these snapshots, let's say, for example, which I talk about for me personally, I have snapshot memories. It keeps them because every time there's something similar to that snapshot that comes in, it's going to go amygdala, quick, quick, quick. There's a problem. We need to just stand guard just in case. So, and I think that's probably, it's a really important point for people to recognize that processing our trauma doesn't necessarily mean that we're never going to be triggered again. And it's okay. It's okay.
You know what? That is probably the nicest way I've heard it described because being somebody that's been that has complex PTSD and has been on a journey since childhood, I've had a couple of major triggers in my life. Even though you live with it every day in some way, shape, or form, I've had two extremely very big triggers, and I literally like that. I felt like, well, I've gone back to the beginning, but actually I haven't because I think my first trigger was having my daughter, my first child, and that was a major trigger for me because how can somebody hurt a child is was the thing
Yeah.
in my head.
Yeah.
And then the second one was when my perpetrator died. And so they were two major triggers. However, ironic that you say you go into recovery and then you work through it. The second trigger I had was far worse for me in my brain, but I was so much stronger as a person and I'm still able to move through it. But I do like that I'm in recovery because we will get triggers, even if you're someone that you feel like you've healed from something, and it could be 10, 15, 20 years down the line, something may trigger you, and you're
Absolutely.
not going to go back to the beginning because you're not who you were in
No.
the beginning.
No, because when we've been in those very dark places and, very, very dark places on multiple occasions, I used to go through cycles of maybe 5 years from a young age. And when we get triggered, this is almost like a secondary trauma response, because
Yeah.
we're like, oh my goodness, I'm going back there. And that, of course, is
Yeah.
our biggest fear.
Yeah, absolutely.
So it is like a secondary trauma response. And if we can come in with that knowledge that, I'm going to be okay. This is a trigger. My nervous system's doing what it needs to do. I now need to really focus on working through this trigger,
Yeah.
not ignoring it, not burying it, feeling the pain and working through it. And I think it's a very kind of compassionate approach to take to ourselves, because we're our harshest critics, right?
Yeah, and I think what you said there is quite prevalent because saying that we like you have to feel the feelings, but that is why people go down the route of addiction
They
because
do.
they don't want to feel those feelings. That is why there is a lot of alcoholism when it comes to trauma. So, yeah, so people talk about how they mask their feelings, and alcohol is one of them. So they drink because they don't want to feel they don't want to feel that feeling. And the same as what you
Yeah,
said earlier, the dopamine, like
yeah,
having that bar of chocolate, you're
yeah,
not feeling the feeling that from the trauma, you're concentrating on that dopamine hit and kind of pushing that feeling to the side because you don't want it.
it's the same as, because so you can talk about it from the perspective of comfort eating, for example. There are people that binge eat or comfort eat. And what actually happens is, when there are these, the emotions start to come up that are related to the trauma or just the survival, in the survival mode, these feelings of overwhelm and not being able to cope, the brain will send a message and it'll go, hey, remember what makes you feel better. Remember, we're always moving towards pleasure. And it's got
Hmm.
memories. Remember, you love the cakes, you love that chocolate, you love, that wine or beer is going to make you feel better. It doesn't know that it has long-term consequences. We're not weighing those up. What
Yeah.
we know is that in the moment, our reward circuitry lights up. We have this moment of, wow, this feels amazing. I'm feeling good. Problem we have, of course, with addiction is we need more and more and more, and binge eating gets worse and worse and worse because we want it. The dopamine spike isn't
Yeah.
so much. So we're now seeking more. And it makes sense. The problem that we have then is, after using the alcohol or after the comfort eating event, comes back
Yeah.
and it's not gone anywhere. And now, if you've got someone that's struggling with, maybe with food or with alcohol, we've got that shame coming in. So we've got an additional layer of emotional distress coming in. And so the brain's going to send another message. Hey, hang on a minute. You know what makes you feel better? It's why people say to me, that they are elbow deep in the biscuit barrel and they
Yeah.
don't even realize they're doing it.
That is the important bit, isn't it? The fact that you've gone into like this automatic mode and you don't know you're doing it.
Yeah. Yeah.
It's yeah, that is scary. And I know of people that have said to me, "Oh yeah, I had a bar of chocolate last night." And I'm like, "Yes, so what? Chocolate is fine." But it's like, "No, but I had a family bar of chocolate and I didn't even know I'd eaten it." Like I
Yes.
got to the end and realized that there was
Yeah.
nothing left. I'm like,
Yeah.
"Okay, that makes sense."
Yeah.
It's
An
it's
emotional
almost like
hunger.
yeah, it's like a switch off though, isn't it? It's like you're even though you know you want that dopamine hit, the fact is if your brain has switched off to the fact that you're eating it, are you even getting that dopamine hit? Like what what is going on there? That is like a really I've explained it before. It's like it's the numbness. It's like when the having an emotional numbness as well as having that dopamine numbness, I guess. You were saying about the nervous system and the sympathetic and parasympathetic. We've got those two kind of things that weigh up. When you're in, I'm gonna say maybe it's freeze mode. If you go into numb, if you go into that kind of moment when you don't feel anything and your emotional system is completely dysregulated, what would you say to somebody that has kind of shut that off? Well, how is their brain kind of engaging it?
Yeah. So when we've gone into freeze mode, this is a complete hopelessness, helplessness. And the way that you approach somebody who has gone into the hypo vigilance, is very, very gently. Very
Okay.
gently, because there's a difference between hypervigilant and we're completely scanning to someone who's now given up, they're withdrawn, isolated. We can get that, like with depression, for
Yeah.
example, when you don't want to get out of bed. And this is about very, very small, safe, comforting steps. Not big, not like, come on, we're going to go out for the night, we're going to go party. It's about very gentle interactions with maybe a pet,
Yeah.
so safe, a safe person,
Yeah.
just like it might be a cuddle, it might be a holding hands, not even that, just sitting together on the sofa. It's not about forcing that person out of that mode, but gently reinforcing the fact they are safe, they're okay, in a very different way to someone who is hyper aroused.
Yeah, that makes sense because we do all react to things in different ways. And I know myself that I've had like a 36-hour period where I've gone from being hysterically crying and all these emotions coming that my body or my brain has got so overwhelmed that it's then shut me off. And it's taken a long time to kind of reintroduce feelings or even get out of bed. Like
Yes.
it's such a when you're in that place, when you're in that bubble, it's hard to break. So if you're somebody that can't get out of bed, it is literally a tick list. I got out of bed, check. I cleaned my teeth, check. I made a drink, check. Because some days you can't do that. Like getting out of bed is like the biggest thing in the world.
It's horrendous.
Yeah. So with that in mind, I know that you have a coaching business, and that is to help people as a brain health specialist, is what I want to call you. You have a certain way of adapting the brain. The way I see it is to make it layman's terms. So you know the ins and outs and the long scientific names, but actually for Joe Blogs or Jane Blogs, you've got a really, really simple way of explaining it to us. So, can you just talk us through your working process, please?
Yeah, so everything that I do actually is very personalized. So I do workshops, which is very general, but when people find there is a non-judgmental space that is only filled with compassion and an aim to understanding, because that's what happened with me. Once I understood, I was like, yeah, that makes sense. Okay, now I can do some healing work. Now I can do this. Um, so the approach that I take is very, very dependent on the person and the challenges that they're facing. And because a lot of people, so bearing in mind, so we've got people, for example, that are coming in that are depressed, that you just talked about, struggling to actually engage in the day. But I also work with people who are very high functioning anxiety, high functioning masking. So it will be very, very different. But the point I want to go back to what, if it's okay, what you just said about that checklist in the morning, and
Mhm.
again about kind of the personalization of that. What I always say, because we have these expectations, I should be able to get out of bed.
Mm,
Now, I know it looks very different, but when I've had my depression episodes, I just sleep.
yeah.
Maybe I'd be awake for an hour, 2 hours, but it's just sleep. Personal hygiene out the window. Don't care, you know. And I remember phoning a helpline and being told to go for a walk. And I do take issue with this because of those expectations.
Mm,
I can't get out of bed. So expecting me to go for a walk. I know walking is good for your mental health, but I was also incredibly jumpy outside of the house, wasn't leaving the house, etc. So the way that I approach it with the people that I work with is, what is one thing that you think you can do today? Just for today. Not what you did yesterday, not what you did a month ago, just for today. And that might be having a shower and getting back into bed. And do you know
mm.
what? That's okay.
Yeah, absolutely.
That is okay. Go and brush your teeth, get back into bed. Change your pajama top, get back into bed. Just one thing.
Yeah.
Because we seem to set our expectations against what society says we should be able to do. And it is, what do you think that you can do today? Because that is enough. That is
Absolutely.
enough. And I guess that's the approach.
Yeah, no, I think that's really important because I can remember somebody said, "Just get out of bed." I was like, "No, I actually want to wallow in my own self-pity today, so just go away." And do you know what? Sometimes we need that, just that reset, and like you said, I love that. So you have got a system to do with the brain that helps us understand. So your triad of things that is obviously very, very scientific, very technical. You do have a simplistic way of explaining it to myself and the listeners. So can you just explain your system?
Yeah. Okay. So it's neuroscience informed, and I'm proud to say it's also very novel. And I've only done 2 workshops on it. I've just started kind of rolling it out. I want it to be accessible to all. So I use that model in my one-to-one coaching, but I'm also trying to get into like GP surgeries and places like that to present this model and practical strategies, because there's so many people waiting for support. There's people being signed off. Also, we're waiting until crisis point, and I think we need early intervention. And basically, with the model, the regions that we've talked about today, so we've got the prefrontal cortex. This is like the neuro lead. This is the leader, the CEO of a company. This is the one that is able to help us guide conscious change, make decisions. We've got the neurodrive, the motivator, human rewards. This is the region that helps us seek pleasure, helps us motivate, build momentum. And then we've got neurosafety. This is the limbic system. And this is a region that's in charge because of chronic stress, because of trauma, because of anxiety. And what it does is sends the 2 other systems offline. So the approach that I take is, one, how can somebody understand which part of the brain is in charge? This helps us depersonalize. This is what's happening in my brain. This is not me with no willpower. This is me not trying. This is not because I'm not trying hard enough. I am unable to be motivated or try because these 2 other regions are offline. And
Yeah.
so that's the first step, is depersonalizing it and going, this is what my brain's doing. Then I talk through the roles of the neuro lead: planning, decision making, emotional regulation, impulse control, and say, what happens when it goes offline? Well, we become more impulsive. We don't manage our emotions. We can't think clearly. We get forgetful. So you're not broken. There's nothing inherently wrong with you. Your system is offline, not through choice, but because your nervous system is prioritizing. Then we've got like that neurodrive. What happens what is its role? Well, this is where we have long-term goals. I'm going to train for a half marathon. I'm going to go to the gym 3 times a week. I love it. I feel really good. I'm going to learn about X, Y, and Z. What happens when neurosafety is involved? It goes offline. This is when we
Yeah.
need short, sharp dopamine hits. I'm going to comfort eat. I'm going to doom scroll. All of those things. There's nothing wrong with comfort eating and doom scrolling, by the way. We're not judging, but we're talking about behavioral responses that are not in alignment with our goals. So then, when we can communicate safety to to neurosafety, we then look at, right, what can I do to get this prefrontal cortex back online? How can I get it to communicate with safety? Say, hang on a minute, you've got help here. You're not on your own, you know?
Yeah,
And
absolutely.
those are the practical strategies, and it will vary from person to person. But, when we're talking about the reward circuitry, we need to be looking at, so basically we'll say, okay, well, where am I getting my dopamine from? Comfort eating. Okay, what's something more meaningful that I can work towards? And then we start planning that in. Well, and connectivity is going to be better for me. So how can I connect with a loved one or a pet? We're not talking about, again, for one person, it may be not leaving the house. So how can we connect in the house, those small wins? Then someone else, it might be actually going out and meeting someone for coffee. But it's about setting expectations that are realistic and manageable. Then the neuro lead, it's like, okay, this is the part of the brain where when we were talking about gratitude, let's reflect on the day. What did I do that I'm proud of? Because people will say, well, I got up and had a shower today.
Mm.
Forget the but, and you're reflecting. We've got that prefrontal cortex coming in. That but, I went back to bed. is now triggering our stress response again because
Yeah.
we're talking about ourselves as failure. So working with the CEO, let's say the leader, I pick up on language, pick up on people's language and say, hang on a minute. And we come in with a compassionate approach. You'll hear me, I've used that word so much. It's validating people, compassion, all of that. And when we can do that, we can de-escalate the stress response.
Wow. It does make sense, because if you think of your brain or your response to things in that way, if you if you were an IT company and you had one of your networks offline,
Yeah.
the rest of the system
Yes.
doesn't work.
Yeah.
Not that I'm We were talking about this before we even got on here, and how we're not IT people. But if that is the case, and it's the same with your car. If you're driving your car and you've got no fuel, the rest of it's not going to work. Or if one of your tires out of the four isn't
Yeah.
pumped up, it's not going to move forward. And I think I said this on another episode, but it's like if we talk of riding the trauma train, you're on the track, you're with the train, you've got one side, the wheels are going round and round, and the other side, they're stuck. You're not going to move forward, are you? So that is a really, really great way of explaining that somebody that has been through trauma, you are going to get days or weeks or months or maybe even years where some things are going to be triggered and you're not going to have. This is probably where the not firing on all cylinders comes from.
Absolutely. Absolutely. And if you think about it, if stress response, safety aspect has taken over, the resources are all going there
Hmm.
because it is all about survival. It is
Yeah,
about survival. And that's how we're wired. That is
yeah.
how we're wired. But we have to remember that, especially if you've experienced trauma from a young age, we take on the narrative of other people very often, caregivers, peers, for example. We embed that as a belief system that we're not good enough and, we're worried about rejection or not achieving. That activates the same system. And so when we're speaking to ourselves in that way, we're going to keep that stress response
Hmm.
going. So we can only move into a place of compassion, bring in the other regions because we need safety there. We need it there, but we just don't want to we don't want it in charge, slamming the door on the other regions.
Yeah,
And they're banging, trying to get out, but no one's listening,
yeah. I love that. But it is so true. And when you think of it and you just take a step back and you just think, hold on a minute, that makes sense. Add those things together, that makes sense. And something else just popped in my mind then. You said about the gut health and our stress responses. That's why a lot of people, when obviously a lot of people comfort eat, but then I've heard a lot of friends, family, and colleagues say, "Oh yeah, no, when I get stressed, I can't eat." Because their
Yeah,
stomach's gone into some kind of, I wouldn't say spasm, but their appetite's kind of gone because
yeah,
I
yeah.
suppose the hormone that makes them feel hungry is gone because it's gone to some stress bucket in the back of their head.
So it's because the rest and digest is the opposite to fight or flight. So anything we get inhibition of activity in the tummy, meaning that we get food sitting there in the moment. So you do find some people seek out food, some people will lose their appetite, and we also see a lot of IBS-like symptoms because of the
Hmm.
food sat in the stomach, and that's because blood flow and priority has moved away. So it's just like everything goes kind of just stops in its tracks. It's like, no, got to divert our resources to this emergency.
Wow. Okay. So, well, that is something
Mm.
I have learned today. So, thank you again.
Yeah.
So, is there anything that you wish that a trauma survivor would know about their brain, and how their brain is working to protect them? Like, even if you don't feel like it at the time.
And that's the most important thing is recognizing that the brain has adapted to prioritize observing threats. And even if something isn't a threat, we'll perceive it as that because it's conditioned that way because we have been exposed to multiple threats. And we're talking about emotional as well as physical. And I think Once we can start to recognize that our brain is doing, our nervous system is doing exactly what it needs to do, we can move into a space of healing. Because people get kind of, I mentioned earlier about kind of this secondary trauma. When we start to notice sensations, we might start to shake, start to notice an increase in heart rate. That can provide secondary anxiety and cause a bit of panic. And if we can go, okay, my body and my brain is sending a signal to my body to do exactly what it needs to do, then we can just pause. And that pause, that slowing things down, is enough to send a message of safety back to the nervous system. So if we can do that, that pause also is enough to bring our more rational, logical thinking processes on board. That's the prefrontal cortex. It's rational. Stress response, irrational. And so if we can just work with, allow those sensations to move through us, slow the breathing down, a lot to be said for it. Slowing the breathing down is the opposite to stress. That's communicating safety. That's why we say slow the breathing down, because it's calming the stress response system. Now we can start to activate the other regions of the brain that can bring reason, logic, and say, hey, look, you've got this. You're okay. You've got this. What do I need right now? That's the question we can ask ourselves. What do I need right now? I need to reach out to someone. I need to go for a walk. I need to actually have a rest. I might need to have something to eat. But knowing that the responses that we have in the body are not something to be afraid of, because like I said earlier, they can be enough to re-trigger.
Yeah.
Because we're brain associate, it's got interoceptive abilities, meaning it attaches meaning to sensations in the body. And if those sensations in the body are associated with trauma responses, then we'll get a trauma. It's a trigger.
Yeah.
So
That
sit with that. Does that make sense?
Yeah, absolutely. And I hope it resonates with the people that are listening, because I think that triggers are a really big part of being a trauma survivor. Now, you may be triggered by a smell, you may be triggered by a sound. So being able to acknowledge that what you're going through is a trigger, and kind of not shaming yourself, or kind of giving your bad mouthing yourself, I suppose. Can you then, I know you said about breathing, that was a really good point. Could you talk us through just a couple of minutes of a practical tip that you would recommend if somebody was outside? So if they were in a supermarket and something had triggered them, is there something they can do in that moment to kind of rejig rejig their
Yeah.
emotional
Yeah, yeah.
regulation?
One of the things, so there's a couple of things we can talk about, a breathing exercise. We can talk about grounding, and also this recognition, raising awareness. I acknowledge that I've been triggered.
Mm.
I understand that I've been triggered because I've been reminded of maybe one way to go, but the other thing can be, and and I am safe. You can say your name, you can say the date, and ground yourself in the here and now, and then bring your awareness to some items that you can see, because that's bringing in the prefrontal cortex. Well, it's bringing in the cortex basically, but we actually start labeling things that we can see. We are shifting away. We're communicating safety to the stress response system, because in the middle of a stress response, a threat, we haven't got time to look around us and go, oh, look at that. There's a packet of biscuits on the shelves. Or look, that's some milk. And I noticed that the floor is grey, whatever it might be. So we're bringing our awareness, because remember, trigger is transporting us back into the past. What we want to do is come into the here. So we acknowledge that we've been triggered. I am safe. This will pass. I am safe. This will pass. And we can remind ourselves again where we are, what we're doing, bring our awareness. And that's like a bit of a mindfulness practice, a grounding
Mhm.
practice. So that's something that I think is quite powerful. Something else that I've used myself is, I do like, people say square breathing or box breathing. Doesn't matter. You can do it anywhere. And this is where we're going to inhale for the count of 4, hold for the count of 4, exhale for the count of 4, hold for the count of 4. Now, sometimes I find that that doesn't work. And that what I start to do with the numbers is in my mind's eye, sparklers that you have like
Yeah.
Halloween, I draw them. I draw the number in my eye. So I'm now using multiple senses. And this, just by detaching from the trigger and integrating our other senses, that is communicating safety, because you wouldn't stop, breathe, draw numbers if there was a real threat in
Yeah.
that moment. Again, you're communicating safety. So those are ways that we can de-escalate a trigger. Once we've managed to say to the limbic system, security, that safety system, hey, hang on, we're okay. That's when we can bring in the other regions of the brain. And we can start bringing in this prefrontal cortex that's now able to bring reason in. Okay, I understand what's just happened. What do I need to do right now? Well, I came here because I was shopping. Maybe I can go to the cafe and have a drink. Do I need to take a moment of pause? Do I want to wrap up now? Or shall I continue with my shopping? And we do that mindfully. Proceed mindfully. Because one of the other things is we have a fear of people judging us.
Hmm.
And we suddenly feel like we're transparent, and everybody can see what's going on underneath the surface,
I can, yeah, absolutely. I think it's, gosh, I just talking about it, I can feel that feeling of judgment. It's so, and no one else knows. It's your perception of the
Yeah,
fact that they're judging you when they're
yeah,
not judging you. And
no,
it's such, that
yeah,
is such a, it's almost like an out of body experience, isn't it? It's so
yes,
surreal.
yeah,
But we all feel it. We all
we
feel it, no
do.
matter what we're doing. Same as, I suppose, going to a this isn't trauma related, but it might be for some people. Going to a wedding and being the first one up to dance. Like,
Yes,
that is everybody stare, all eyes are on you, and you literally, that's where you think the
yeah,
judgment is coming from. So
absolutely.
I think what you said then when you said, I am safe, this will pass. And looking around wherever you are, because even if you just like tap your fingers, go one,
Yeah,
two, three, four, five,
yeah,
I think
yeah.
it's really good because it brings you back to that moment. So that's an amazing, amazing practical tip. So I would like to ask you one final question. And this is what I call the conductor's question. I have to bring it back to trains because obviously that is what this podcast is, riding the trauma train. So obviously at the beginning of this episode, you said that you went through your own traumas, you have kind of developed yourself and got some amazing degrees, and you've now used that to move forward and help people. How, if you had Tracy sat on a in a coach next to you when she first boarded the trauma train, what advice would you give to her now?
Powerful question, isn't it? Because I feel the emotion. I do feel the emotion come up. And I think, and it's giving me goosebumps actually. And I think one thing that I would say to her is something that I say to myself now: you are enough. You are enough. You were always enough. You will always be enough. Life is going to throw challenges that are going to feel really hard to bear. And there's going to be times when you think you're not going to be able to get through it. But I promise you, you absolutely will get through it. And you're going to move into a space where you'll be able to help other people. It's going to be bumpy. It's going to be bumpy, but you're going to get there. And I think that's the biggest thing. And also, I guess things won't always make sense, and that's okay. They won't
That
all
is
make sense.
beautiful.
Mm.
Absolutely beautiful. And I'm sure there are so many people that could take that person and put themselves in that position and think, actually, I need to hear that. So thank you so much. If anybody wants to work with you one to one or either in your workshops, how can they reach you?
So you can reach me via my website, which is www.connectionshealthcoaching.com. I run workshops and I do one-to-one. I have various social media, so TikTok and Facebook. And my email address is drevans@connectionshealthcoaching.com. educator.com. And I'm working on some ebook resources. I realise not everyone's in a position to do one-to-one personalised coaching. So I'm trying to bridge as many gaps as I can. And I'm always open to suggestions.
Amazing. Thank you. So, if anybody listening to this has been triggered, if you've got any questions, then obviously reach out. You can comment below, subscribe, like, and share. If you think somebody else would be really interested in hearing about the brain, I know it just fascinated me, then obviously share this podcast with them. If you'd like me to talk about anything else, my DMs are always open, and that's Instagram, Writing the Trauma Train, TikTok, and Facebook. So thank you all so much for joining us, and thank you, Tracey. It's been a pleasure.
Thank you for having me.
Thank you so much for joining me today on Riding the Trauma Train. I'm Lydia, and I feel privileged to share this space with you. No matter where you are on this train right now, whether it's in survival mode, slowly finding your feet in recovery, or maybe it's somewhere in between, remember, you are not alone in what you're feeling, and you do not have to travel this journey by yourself. So if you'd like to continue traveling together, please follow Riding the Trauma Train wherever you're listening, so you can join us at the next stop. Until next time, take care.